Hi all, this is Dr. Shubha, consultant gastroenterologist, hepatologist and interventional endoscopist based at Lifeline Hospital, Kilpok in Chennai. So today I'm going to talk about a very common condition which I've been seeing lately, especially post the onset of the COVID-19 pandemic, which is a complaint of heartburn. So heartburn, otherwise in Tamil terms, it's called Nenju Erichal. So 5 out of 10 patients which I see on a daily basis, which is almost 50% of patients we see on a routine basis complain of heartburn. So now what is the most common cause of heartburn? Earlier it was commonly believed that only the elderly were facing gastroesophageal reflux disease or GERD and heartburn, but of late I see even teenagers, adolescents and very young individuals with complaints of gastroesophageal reflux disease landing up with complaints of heartburn. So what is the most common cause of this heartburn? The most common cause why people land up with GERD or heartburn is lifestyle related, which is actually 90 to 95% preventable. Smoking, consumption of alcohol, taking an inappropriate diet at the inappropriate time, loaded with processed food, all contributes to gastroesophageal reflux disease. So now how do we actually diagnose whether it's a common cause of acidity, GERD or peptic ulcer? So the common investigation as a gastroenterologist which I suggest to my patients is an upper GI endoscopy or a esophageogastroduodenoscopy. So this is commonly done as an outpatient basis. It is only a 10 or 15-minute procedure. If you are very anxious, we can give you an IV sedation, and it actually gives the doctor a lot of information about whether you are having a common heartburn, whether you're having peptic ulcer disease or whether you're having gastritis, which could be due to other causes. So once the endoscopy report is available for us, what are the modalities of treatment? So usually we recommend a diet and lifestyle change, which is very, very important and can actually help to control and bring 90 to 95% of heartburn back to normalcy. So what do we suggest? The first and foremost thing I always suggest is to eat on time. So make sure you have all your 3 meals every day roundabout and approximately at the same time of the day. Avoid alcohol and smoking. Please do not eat heavy meals right before you go to bed. Ensure you have a time interval of at least 1 to 2 hours before you actually have your last meal and hit your bed. Another important thing is to work on your sleep cycle. So it is very important that you bring your digestive system on par with your circadian rhythm, which is nothing but the cycle of the sun. So in layman's terms, actually dating back to history, we usually hear a lot of our grandparents and great-grandparents say that you should wake up at the time of sunrise and have your last meal at the time of sunset. So this is something I commonly tell a lot of people to actually adopt, and it's a wonderful lifestyle change in order to bring your gastric issues to normalcy. Another important thing would be to start off with medications if your doctor suggests, because unless and of course you are on a course of medicines, it's not going to bring your symptoms down. So we will give you a trial of medications for about 2 to 4 weeks, following which we can order a few tests to see whether your issues are getting back to normal or not. So once the trial of medication is completed, we have other tests available at our institute, which are 24-hour pH monitoring, where we check your acid and alkaline reflex. So now not all heartburn patients have a hyperacidity or increase in acid output. It could also be because of alkaline secretions, or which is nothing but bile. So we have a 24-hour pH monitoring available at our Lifeline Hospital, and it really helps to categorize our patients into the acid and the alkaline groups. Other than that, certain neuromotility disorders such as achalasia can also present with heartburn. So we have a high definition, high resolution manometry test available with us. So this test also helps to give us a lot of information about the category and the severity of your heartburn. Now, a commonly asked question by most patients is that if I have a heartburn, what do I eat and what do I avoid? So as far as diet goes, I would say you can adopt a healthy, basic diet which is cooked at home. Avoid eating out and too much of junk food from outside. And as far as restrictions are concerned, low oil, low spice and low salt is the way forward. Okay, so avoid deep fried, salty, spicy food, and occasionally it is fine, but not on an everyday basis. When I say avoid processed food, I also mean avoid ketchups, soya sauces, and a lot of other food which is available in a bottle, especially instant foods, which are, you know, the 2-minute foods which you can cook and have on the go. So all that can contribute to heartburn, because a lot of chemicals, lot of preservatives, a lot of other acidic regulators which can actually increase your chances of developing a gastritis and GERD. So take care, stay healthy, and remember that gut health related issues are mostly lifestyle related. So we are always here for you to address that. Thank you.